Future Surgeons with Professor Dr. Zahid Mahmood. Welcome to the Surgical Learning Series with Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College. Let us master today's important SEQ, simple, focused, and exam-ready.
I am speaking on behalf of Professor Dr. Zahid Mahmood, Professor of Surgery at Lahore Medical and Dental College, Lahore. In this series, we will cover important SEQs from UHS past exams. These are high yield for your professional exams and essential for clinical practice. SEQ 26, a 60-year-old shopkeeper has a swelling below and in front of his left ear for the last 15 years. It has recently increased in size. Answer: the diagnosis is pleomorphic adenoma of the left parotid gland with possible malignant change. Clinical examination: check facial nerve function. Do bimanual palpation of the parotid gland. Examine regional lymph nodes. Management: confirm diagnosis by FNAC and imaging like CT or MRI. If benign, perform superficial parotidectomy with facial nerve preservation. If malignant, do radical parotidectomy with neck dissection. Closing: always mention facial nerve examination and type of parotidectomy in your answer. Teleprompter script: SEQ 27, gas gangrene, delayed trauma case. Case SEQ 27, a 65-year-old man presents 1 week after a road accident. His leg is swollen, tender, discolored, and crepitus is felt under the skin. He looks toxic. Answer: the diagnosis is gas gangrene of the right leg. Confirmed by X-ray, which shows gas in subcutaneous tissues. Treatment: immediate and aggressive action. High doses of penicillin or clindamycin with metronidazole. Wide incisions for drainage and removal of necrotic tissue. Blood transfusion if required. Use of hyperbaric oxygen therapy where available. Closing: this SEQ is life-saving. In exams, always emphasize urgency and wide debridement. Teleprompter script: SEQ 28, carcinoma esophagus, elderly man with dysphagia. Case SEQ 28. A 75-year-old man has progressive difficulty in swallowing solids and weight loss. He also has a small firm swelling in his left supraclavicular fossa. Answer: the likely diagnosis is carcinoma of the esophagus. Investigations: barium swallow, endoscopy with biopsy, CT scan of neck, chest, and upper abdomen. Management: counsel patient and family according to tumor stage. Surgery or radiotherapy if tumor is resectable and localized. If not resectable, provide palliation by esophageal stenting or bypass surgery. Closing: in exams, always include staging, operability, and both curative and palliative options. Teleprompter script: SEQ 29, maxillary sinusitis, swimmer with headache. Case SEQ 29, a 14-year-old swimmer presents with headache, fever, and nasal blockage. The headache changes with posture. Answer: the diagnosis is maxillary sinusitis. Investigations: X-ray paranasal sinuses, CT or MRI of face if needed. Treatment: nasal decongestant drops, analgesics and antibiotics, antral lavage if pus is present. Endoscopic sinus surgery for chronic cases. Closing: this SEQ is simple. Always mention both medical and surgical options briefly. Teleprompter script: SEQ 30, Ludwig's angina, post-dental infection. Case SEQ 30. A 50-year-old teacher develops a swelling on the floor of mouth 3 days after tooth extraction. The tongue is displaced upward and she has difficulty breathing. Answer: the diagnosis is Ludwig's angina. The serious complication is airway obstruction from glottic edema. Management: broad-spectrum antibiotics like amoxicillin or cefuroxime with metronidazole. If no improvement, drain both submandibular spaces through a curved submental incision. Incise mylohyoid muscle to decompress the floor of mouth. Insert corrugated drains. Tracheostomy may be required if airway is compromised. Closing: in exams, always write airway management first. It is the key to saving life.
You have been learning with Professor Dr. Zahid Mahmood, Professor of Surgery, Lahore Medical and Dental College. For more SEQs and surgical tips, subscribe now. and join us again for your next step toward exam success.